We saw these really big differences in what parties were telling people to do and what to be afraid of.
We're back with this special edition of The Big Deal on the 5-year anniversary of the coronavirus pandemic. 2020 did not just mark an unprecedented health and social crisis, it also exacerbated the existing partisan divide in the United States. And now, 5 years later, there's still a massive gap between Americans when it comes to COVID. A new survey by the Pew Research Center found that a majority of Republicans believe COVID is something we no longer need to worry about, while a majority of Democrats say that COVID is not taken seriously enough. Joining me now with more on how the pandemic has changed politics is Shana Kushner Gadarian, a political scientist and professor at Syracuse University. She's the author, by the way, of Pandemic Politics, The Deadly Toll of Partisanship in the Age of COVID. Professor, I want to read a section of your book that struck me where you write, and I'm quoting, "Deep partisan polarization created two pandemic realities in America, one where the pandemic was taken seriously and one where the pandemic was an inconvenience." And you write that other countries fared better than the U.S. and that here partisan politics made the crisis worse. Why did that happen?
Sure, great question, and thanks for reading the book. So the first thing I would say is, my co-authors and I write in the book that the background of the United States is already pretty challenging for a crisis, right? We have a fragmented federal system. We have a very challenging healthcare system that's deeply unequal. We have inequality in income, but also we have deep political polarization that came through, and doesn't always come through with public health, but did come through in the pandemic. We had one party telling people, the Democratic Party telling people to stay home and that COVID was a risk. And we had Republican leadership, particularly from the White House, telling people COVID isn't a threat. And even if it were a threat, we don't need to respond in such a stark way as lockdowns. Now, I'll say the White House did come along pretty quickly in terms of getting people to stay home. But we saw lots of differences across states based on their leadership in both telling people whether or not they should be afraid of COVID and what were the appropriate responses, both at the individual level and the community level. So we saw these really big differences in what parties were telling people to do and what to be afraid of.
The pandemic also exposed an erosion of public trust in our federal government in particular. Is the spread of misinformation a result of that loss of trust, or was it the cause of it?
Yeah, that's a good question. So I think misinformation was certainly an issue early on in the pandemic. Again, some of this is a lack of information. It was a new novel threat. People don't know what to do with that, and they're looking to their leadership to tell them what to do. It's also the case that there was a lot of changing information really quickly. Should we mask? Should we not mask? What's the right way to deal with the pandemic? So I think some of that is not necessarily about misinformation, but it was about the lack of information. But there was a whole series of conspiracy theories and a lot of misinformation that was coming partially from the White House and partially from other leaders who were trying to both, again, tell people that they shouldn't be afraid, or that the pandemic was made in a lab, it was a kind of a bioweapon. These kinds of conspiracy theories aren't very helpful. I think misinformation predates the pandemic, but I think you saw an acceleration of it. And you saw an acceleration, particularly on one side of the political spectrum.
Okay, so now coming back to 2025, President Donald Trump has picked a vaccine skeptic, Robert F. Kennedy Jr., to be the Secretary of Health and Human Services. Dr. Jay Bhattacharya, a critic of pandemic lockdowns, now leads the National Institutes of Health. Where does that put our nation in terms of being prepared to handle the next pandemic?
Yeah, that's a good question. So I think we are not in a very strong position, not just because of the leadership at these agencies, which is troubling, but I think more generally because some of the funding from National Institutes of Health and National Science Foundation that was going to doing pandemic preparedness, studying vaccine attitudes, those have been stopped from the recent changes at NIH. And I think that in itself is troubling. There's been a kind of a lack of interest in data collection and surveillance on areas around pandemics. And this will be a problem as we see potentially avian flu becoming more of an issue if it's kind of jumping to people soon. And we don't always know what the next pandemic is. It's also likely that climate change is likely to make pandemics worse. And there's again a skepticism about studying and taking seriously the threat of climate change. So I think while we have the tools to be prepared for a pandemic, we don't necessarily have the leadership who is taking that as a serious threat as they're turning their attention to other threats.
Okay, we're going to leave it right there. Thank you so much for your insights, Professor Gadarian. Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.